Hey everybody, we're going to talk about some tracings that are in your course pack, and they are on the bottom of page 105. There are 4 tracings down there, and those 4 may appear on your next test. That would be exam 4. So what I'd like to do is walk through what happens when there's no filtration, when items are secreted, when items are filtered and reabsorbed, versus when items are filtered but not reabsorbed. So you'll notice on the bottom of page 105, that there are various things that we're following. For instance, when we're looking at no filtration, we're watching an item that wouldn't be filtered, like a red blood cell. Or typically creatinine can be secreted, so we're looking at that as an example. We know that bicarbonate ions can be reabsorbed, so they would be filtered then reabsorbed. And likewise, sodium may be filtered but not reabsorbed. So there are clues in the questions here that tell you where to start and end, and we're going to pay attention to that as we travel through the next set of slides. So first of all, I'm going to talk to you about items that are not filtered. So items that are not filtered would be things like red blood cells, white blood cells, platelets, and plasma proteins, because they're all too large to be filtered. And if they are able to escape through the filtration membrane in the glomerulus, there is no mechanism for reclaiming them back into the bloodstream through reabsorption. So once they're filtered, they would be gone. So we're going to assume that these 4 things here are not filtered as they travel through the kidney. Their pathway would simply be the blood flow, starting with the renal artery to the segmental artery, interlobar artery, arcuate artery, interlobular or cortical radiate artery, afferent arteriole, glomerulus, then head on back, afferent arteriole, peritubular capillaries, evenule, interlobular or cortical radiate vein, arcuate vein, interlobar vein, and renal vein. Notice there was no filtration here. That would have occurred at the glomerulus. Next, let's talk about secreted items. We're going to use creatinine as our example. So we're going to start with the blood flow. Of course, we travel through the renal artery. What is the next place we go? Segmental artery. What's next? Interlobar artery, arcuate artery, and then interlobular or cortical radiate vein. So once again, we've got renal artery first. We branch off into around 5 segmental arteries. It's going to use A there for artery. These segmental arteries branch into interlobar arteries. Those interlobars branch into arcuate arteries. And finally, we have these cortical radiate arteries or interlobular arteries, your choice there of terms. If you do use interlobular, just keep in mind there's a very tight spelling difference between those 2 terms. All right, from the interlobular arteries, we're now going to travel into an afferent arteriole. And keep in mind what we're doing here is we're following an item that is secreted. So from the afferent arteriole, we travel through the glomerulus. Because it's secreted, it will not be filtered here. This item continues on traveling to the afferent arterioles and onward toward those peritubular capillaries. Now, this is where we are going to secrete these items into the renal tubule. And a lot of our items are secreted into that DCT. So from here, we travel to the distal convoluted tubule. And now you're in the renal tubule system. From the DCT, just follow this pathway. We travel over here toward a collecting duct next. From the collecting duct, we travel toward the tip of a renal pyramid. And of course, the urine drips from that renal papilla. And from that renal papilla, the fluid travels to the minor calyx, right around here, to these major calyces, to the renal pelvis in that area there. From the renal pelvis down the ureter, to the urinary bladder, and then through an internal and external sphincter as it passes out through the urethra. That's how items are secreted. They're destined for urination out of the body. Let's now talk about items that are filtered and reabsorbed. We're going to use bicarbonate ion as our example. Well, we're going to pass through the renal artery first, next through the segmental artery. What's next? Interlobar artery. Now we're out here with these arcuate arteries. And then these on the perimeter around the cortex are called cortical radiate or interlobular arteries. So this time we'll use cortical radiate. All right, let's now talk about where we go next. Here we come with an interlobular or cortical radiate artery here. We travel to an afferent arteriole and then to the glomerulus. It is at the glomerulus that filtration takes place. All right, so from filtration, this item will now travel into the PCT because we are going to capture that item in the Bowman's capsule. The item will travel into the PCT, and it's not going to go very far because it's going to get reabsorbed back into the bloodstream. And so this item that we're talking about, bicarbonate, will move into the peritubular capillaries. Well, you know the story from here, right? We're going to head back in the pathway that's in the veins. We're going to go to a venule, to the interlobular or cortical radiate vein, next to the arcuate vein, and then, of course, finally to the interlobar veins, and then to the renal vein. Okay, so that completes filtered items that are reabsorbed. That means that they are kept and put back in the body's blood supply. Let's talk about items that are filtered but not reabsorbed. This time we're going to use sodium ions as our example. All right, so we should be good at doing this now, right? We're going to start with the renal artery. The next branch is called the segmental artery. The next branch down here is called our interlobar artery. All right, what's next? Arcuate artery. And finally, what's the last one called out here? Two names, cortical radiate artery or interlobular artery. Okay, and we're traveling along into interlobular artery here, afferent arteriole, and what happens at the glomerulus? That's filtration. So we're following an item that's not reabsorbed. So when the Bowman's capsule captures that item and it travels to the proximal convoluted tubule next, it will not rejoin the blood flow because items that are not reabsorbed ultimately end up in urine. So just follow with me from PCT down through this nephron loop. You can call it nephron loop or loop of Henle, your choice. Travel up through the DCT. All right, travel over here toward this collecting duct. We know that collecting duct is aimed toward the tip of a pyramid. That tip is called a renal papilla. From the renal papilla, urine will drip into minor calyces, major calyces, then the renal pelvis, down a ureter, into the urinary bladder for storage, out the urethra as it passes through the internal and external sphincters to the outside world. So keep in mind, this pathway we just completed are items that are filtered but not reabsorbed. They're allowed to leave in the body's urine. So in conclusion, this is going to help you with the tracings on the bottom of page 105. And you'll want to flip through your course pack because these tracings are already completed for you. All you need to do is use this video and link them back together with what's written in your course pack. Like I mentioned earlier, a couple of these will appear on exam number 4.